Anxiety and depression are both extremely common following concussion injury, and they're also very large barriers to concussion recovery, which means that if you have ongoing anxiety and depression, which may be pre-existing, right? You may have had it before the injury and now it's just exacerbated because of the injury, or you may have it because of the injury, right? You didn't have it before, but now you're anxious and depressed because of the injury or because of the recovery, right? Once recovery starts stretching on for months and months, this stuff starts to increase because you start to think, am I ever going to get over this, and am I going to feel like this forever? And is there any solution to this issue? And that right there, that type of anxiety and depression that happens with concussion, not only does the symptoms of that can mimic concussion. So oftentimes the symptoms of anxiety and the symptoms of depression very much look like concussion, right? So you might just be dealing with anxiety and depression, which you're attributing to concussion, but actually there's nothing wrong with your brain. There's nothing wrong with your vestibular system, but it's the anxiety and the depression that goes with it that starts to look like it. That can happen. But also anxiety and depression becomes a barrier to getting better, because what do you have to do when you have a concussion is you have to push yourself. You have to move beyond your comfort zone. You have to do things that make you uncomfortable. Well, if you're anxious about that and worried that you're doing some sort of damage, you're going to avoid that type of activity. And if you avoid that type of activity, things get worse over time. So anxiety and depression is a huge barrier to concussion recovery, but the symptoms also mimic concussion. So it becomes this very difficult thing to manage. But if you don't find a way to control your mental health, you're going to have a very difficult time with your recovery. So, and it may not actually be, the concussion. This may just simply be an anxiety disorder or depression. For example, I am still not 100% convinced that I don't have COVID-19. I haven't seen a patient since last Tuesday. I'm on day 8, but then I read a story that says incubation period could be as long as 14 days. And I started going through the patients that I saw last Tuesday and thinking, oh my God, which one of these people has given me this? Now, the likelihood of this, there's 600 cases now in Canada. What are the chances that one of those 600 cases was somebody that I saw last Tuesday when we only had, a few hundred cases, is extremely low. But anytime I get a sniffle or I cough or I feel a little bit phlegmy or anything like that, I start immediately to have this wave of anxiety and start to feel maybe hot and go, oh my God, do I have a fever? And your mind can trick you into so many different things, right? Because then you start to realize, well, the likelihood of that would be so low, and you have to kind of convince yourself out of it. But if you are walking around convincing yourself that there's something seriously wrong with your brain, and that's all you keep thinking about is anytime you look at a light or you look at a computer screen or you see a TV screen, you think, oh my God, that just made me worse, or that's going to impact my brain. You're not going to be able to live your life normally, and you're not going to be able to do the steps necessary in order to recover. So things you can do for yourself, for your mental health, is you can do talk therapy. Even in this period of reduced socialization and, reduced access to clinical care, a lot of therapists are offering virtual care. I've actually just called my doctor and I've got set up with a social worker to do virtual type visits. So a lot of social workers are doing this. There is support out there for people that may need it. So don't discount that. I think the power of that can be tremendous. But also things like mindfulness-based meditation. There's several apps out there. I use an app called Waking Up. I think it's Sam Harris is his name, but it's really great. It goes through a day by day. It kind of builds on stuff, and I find it very helpful when I'm feeling this way. So just being able to kind of do those body scans and deal with the mental health aspect will help you to potentially realize that some of the symptoms that you are experiencing may be psychosomatic. Just like my breathing difficulties, right? When I start thinking I have COVID and I start having tightness in my chest and coughing a little bit, that's completely conjured by my mind, but it's so real to me at the time, right? And that's what we need to kind of get our heads around when it comes to concussion, is just acknowledge that it could be the case.